Coronavirus disease 2019 or COVID-19 is an infectious disease caused by the virus severe acute respiratory syndrome coronavirus 2. The disease was first identified in Wuhan, the capital of China's Hubei province, in December of 2019. Since then, it has spread around the world and resulted in a global pandemic. The most common symptoms of COVID-19 infection are fever, cough and shortness of breath. But other symptoms can occur too, including the loss of smell, a sore throat, muscle pain, a wet cough, diarrhea and abdominal pain. Most cases are mild and do not need hospital care. However, some COVID infections will lead to viral pneumonia and the failure of the respiratory and other body systems. For those cases, hospitalization is frequently needed for breathing support, with oxygen or a mechanical ventilator, along with therapy to support the circulatory system, kidneys and other body systems. As of 13 April 2020, more than 1.89 million cases have been reported in more than 200 countries and territories, resulting in over 118,000 deaths. More than 444,000 people have recovered. The virus is mainly spread during close contact, and by small droplets produced during coughing, sneezing or talking. Close contact is defined as 1 meter or 3 feet by the World Health Organization and 2 meters or 6 feet by the United States Centers for Disease Control. The small droplets of infected sputum can also be produced during breathing, but fall rapidly to the ground or surfaces, so they are generally not thought to be able to spread COVID-19 over large distances. The infected droplets can survive on surfaces for up to 72 hours. And spread person to person by touching a contaminated surface and then their face. The average time from exposure to onset of symptoms is 5 days, but it can vary from as little as 2 days to as many as 14. The standard method for diagnosis of active COVID-19 infection is with a swab of the back of the nose and back of the throat, which is then tested for the virus using a reverse transcription polymerase chain reaction or PCR process. The infection can also be diagnosed from a combination of symptoms, risk factors and a chest CT scan showing features of pneumonia. The recommended measures to prevent infection include frequent hand washing, social distancing, covering coughs and sneezes with a tissue or inner elbow, and keeping unwashed hands away from the face. Social distancing, or maintaining a physical distance from others and not congregating, has been a key tool used by communities to slow down the intensity of the pandemic. The use of surgical mask is recommended for anyone who suspected of having the virus to prevent the spread of infected droplets. Caregivers should also use masks, face shields, and other personal protective equipment when caring for people with active COVID-19, and high-filtration masks, like the N95, for any activities that may generate aerosol from an infected patient. Recommendations for and against mask use by the general public vary by country and region. Currently there is no vaccine or specific antiviral treatment for COVID-19. Management involves treatment of symptoms, supportive care, isolation, and experimental measures with hospitalization for severe cases. The World Health Organization declared the 2019-20 coronavirus outbreak a public health emergency of international concern on 30 January 2020, and a pandemic on of March 2020. Local transmission of the disease has been recorded in most countries across all 6 WHO regions.